I'm Federico Foschi, Professor of Endodontology and Honorary Consultant at UCL Eastman Dental Institute. Endodontics, it's a specialty of dentistry which pertains to avoiding infection within the root canal system, preventing infection and curing it. So basically by avoiding abscess for the patient and helping retaining teeth for longer in a healthy status and restoring them and keeping them in their mouth.
There is an increased demand in endodontics in the general population, and this is because we have people living longer in an ageing population and that they're retaining their teeth much longer. The students will start in the laboratory to introduce their practical skills, and they'll be mentored along this with demonstrations and hands-on demonstrations. And they'll need to improve on their skills during this course before they progress on to clinic. They'll be taught modern, contemporary endodontic techniques, and the idea is for them to safely and effectively practice modern clinical endodontics.
The academic component of the course is led through seminars. So we have a series of seminars that we will be doing during the first year of the program. Those seminars will allow us to understand the biology behind endodontics, and as well as the management and treatment options thereafter. Together with that, we are then learning about techniques which we may utilize during our clinical practice. Coupled with the academic component, we also have clinics on a weekly basis. So that allows us to implement the knowledge that we gain from our seminars.
I work in general practice outside of the hospital for 2 days a week, and the rest of the week I spend here at the hospital and at UCL managing patients referred in for treatment. So I chose to study endodontology at UCL because it's a world-renowned centre for dental education and postgraduate research. I really enjoyed the small learning groups and the exposure to this kind of quite wide knowledge and specialist knowledge which you wouldn't necessarily acquire at an undergraduate level in practice. And also we've been exposed to quite a number of patients at the hospital, and they present with a wide range of complexities in practice. So that's what I've enjoyed, deepening my skills.
Endodontics has greatly changed in the last couple of decades because of many research development, many aspects which now are provided also by the course, which is example the CBCT 3D imaging, which helps into gathering a better diagnosis for the patients, treatment planning, and creating a easier treatment even despite the difficulties that endodontics can present. The practical skills are very important in a course such as endodontic specialist training and postgraduate training as such, because this requires a direct clinical supervision which often is missing in other type of courses. So having a small focus group with hands-on practical which can be repeated and reproduced efficiently and effectively, together with the direct over-the-shoulder clinical supervision. This is very important for the student because they can practice directly within the clinical field with a direct feedback. So the supervision ratio is quite good in terms of number of tutors, all experienced specialists and consultants, which can help the student progress and also custom tailor their training based on what they're missing or what they need to improve upon by basically modifying the course based on this necessity.
So what appealed to me is, first of all, I liked the surgical side of things. So endodontics does allow you to do some surgery, as well as it's a very hands-on treatment that you're doing, which I really liked, with high precision. But also, it's always great, I feel, to save teeth. Nothing like your own tooth, and especially as we all are living longer, we've all are now also retaining our teeth longer. It's something that I wanted to do to enhance the clinical knowledge and skills that I already had, and take it that next step and be able to do more complex cases in clinic independently.
working back to back with the like-minded people, such as other students or professionals from other fields, is very good experience, which leads to a lot of self-development as well. You can closely work with the consultants of other fields, work on the very complex cases, which is really useful for the future practice.
So there's a strong clinical emphasis as part of the course. We have the opportunity to develop our skills treating many complex endodontic cases, and I think that this helps us to ensure that we are confident in managing these cases within a general practice environment as well. So I would definitely recommend this course to anybody who is thinking of specialising within the field of endodontics. This course not only allows us to develop our clinical skills to the highest possible standard, but also gives us lots of opportunities for developing skills within teaching and academic research as well.
If you want to become an expert and you want to gain the skills and knowledge on how to do that, I'd 100% recommend you apply for the course.